Well, the World Health Organization is stepping up efforts to ensure that people living in rural areas have better access to health care. It's drawn up recommendations to governments around the world on just how to improve the recruitment and retention of healthcare workers in poor communities. While healthcare access in rural and remote areas remains a challenge, the WHO hopes that the guidelines will help policymakers to improve living conditions. We're here to tell us more about the launch of those policy recommendations is Africa Health Placement's Chief, Saul Kornik. Saul, good morning. Thanks for joining us.
Good morning,
We're living with the problem of rural, the disconnect between the kind of services you get in an urbanized area versus the rural areas. And it really is simple. A lot of people come from rural areas to city areas, and there should be more of a focus on healthcare in those areas. What is the biggest challenge still in 2010?
In terms of delivery in healthcare in rural areas, definitely from our perspective, it's the shortage of human resources in health. Often the facilities are available, pharmaceuticals are available, but sometimes they're just not the staff to deliver those healthcare services.
And why is that? Is it because of money? Is it because,
It's a very complicated situation, and that's why these guidelines have come out. The guidelines address the 4 main areas that do prevent human resources from being retained in rural areas.
All right, highlight them for us.
Firstly, there's the financial incentives, which always come up first. But obviously, if you're working under bad working conditions and somebody asks you, what's the pay like, you'll say, well, I'm not paid enough to do this. So financial incentives are just one part of it. The other part is got to do with personal and professional support. So doctors working in rural areas, nurses working in rural areas, often feel as if they're isolated professionally and don't have the camaraderie that health workers in urban areas will have. There's also education, which is difficult to access in rural areas. And finally, there's some regulatory incentives and ideas that are included in the guidelines, which policymakers need to incorporate.
All right, so what happens from now on, though, Paul? We have these recommendations that have been made to government, and one finds it stunning that government still hasn't addressed these. I mean, you spoke about health. It's just one aspect. Education is another. I mean, schools under trees is still a reality in South Africa today. It is a critical area. And what are some of the ways being mooted to get around the problems you've highlighted?
Well, first of all, it's not a problem endemic to South Africa. It's a worldwide problem. Even developed countries like Canada and Australia have a shortage of human resources in their rural areas. So it's not just South Africa that suffers from this. In terms of what South African government is doing to address this, well, they've started looking at, they've implemented rural allowances in the past, but they need to take a look at the guidelines and implement some of the ideas in there. I think personally that one of the biggest things that needs to be addressed in rural areas is the quality of management at a hospital level. Often the managers there aren't aware of what needs to happen in order for them to manage a public sector facility properly. And often they don't have the management skills necessary. And what we're finding is the health workers who we're placing in rural areas aren't being retained because they don't have a supportive management structure. And second of all, we aren't actually able to get those health workers there because the management at the hospital level isn't able to just simply organize the paperwork and get things through the provincial level.
I mean, as you were talking about, it's not a problem that's unique to South Africa, and it's not a problem that's unique to rural areas. We have a similar kind of administrative problems in hospitals in urban areas. The point is really that national health has to take responsibility here. They have to incentivize the profession more, and also keep a closer hand on what's happening in the rural areas. How do you see that evolving from where it is now to a place where there is direct contact with the national office, for example, or there's regular training for doctors in situations like that? There's better management infrastructure put into place.
Right. Well, increasingly the government is collaborating more with civil society and private sector, and the big hope for staffing in rural areas is that this goes forward. It cannot just simply fall in the shoulders of the government. It needs to come down to the universities in terms of where they're selecting their students from. It's been shown over and over again that if you select a student from a rural area, it's more likely that healthcare worker will return back to the rural area afterwards. So the universities need to get involved. Social enterprises and civil society need to get involved as well in terms of taking the initiative, taking a look at the guidelines and seeing what can be done. The organization which I'm involved in, Africa Health Placements, is part of that. I know there are a number of organizations across the country that do that. Private sector and public sector need to come together to create training institutions to produce more health workers.
But I think what you said there was key, recruiting someone from the community. They have more of an interest in developing that community and investing their time. Very quick word on what is the outlook? Does it look positive? Do we have the tools and, more importantly, the political will to carry this out?
From the launch over the last 2 days, I'd say the political will looks to be there. I think critical to this needs to be a change in the perceptions of what it means to work in a rural area. It needs to be glamorized the same way as CSI Miami has glamorized forensic medicine.
All right, let's see if we can achieve that. And it is, as you say, a critical area. Saul, thanks for explaining it to us this morning. We appreciate it. Saul Kornik, who's the Chief at Africa Health Placements.
Let's continue with stories on Morning News today. The whole